Hello, thank you for taking the time to review our training for general anesthesia updates. The purpose of this training is to provide our network providers and office personnel with updates related to general anesthesia for the Idaho Smiles program. So as of July 1st, 2023, pre-authorizations for dental services planned to be performed in conjunction with general anesthesia should be submitted to MCNA. The situations in which this applies to are services being performed in office by a dental anesthesiologist or delegated certified nurse anesthetist for members 21 and under. Services are being performed in any setting for members 6 and under. Services are being performed in an ambulatory surgical center and exceed benefit limitations set forth by the Idaho Department of Health and Welfare. The dentist submitting the prior authorization may then provide documentation of MCNA's approval to the anesthesiologist, provider, or facility. So next is an outline of each scenario. So for in-office general anesthesia for members 21 and under, the dentist performing the dental procedures is responsible for demonstrating the need for dental services to be provided under general anesthesia and obtaining the prior authorization from MCNA. They would submit the authorization for a D9999, including the filled out Idaho Smiles anesthesia prior authorization form that we'll review next, as well as the treatment plan if one's available. For general anesthesia services for members 6 and under at any place of service, an authorization will also be required when the services are being provided in an ambulatory surgical center or outpatient hospital by an MD, a DO, or a CRNA. The dentist performing the dental procedures will need to submit the authorization to MCNA utilizing the D9420 code. This authorization should also include a filled out Idaho Smiles anesthesia prior authorization form that we'll review next, as well as the treatment plan if one's available. And lastly, for services being done in the ambulatory surgical center that require prior authorization per MCNA's provider manual or exceed benefit limitations set by the Department of Health and Welfare, the pre-authorization should be submitted for the procedure code that represents the services being performed, along with supporting documentation. So next is a look at the Idaho Smiles Dental Anesthesia prior authorization form that was mentioned previously. So the first section is where you would indicate the member's information. The second section is where you would indicate the treating provider who will be actually performing the dental procedures and submitting the authorization information. You'll want to make sure that in this box, the place of treatment is indicated appropriately. The next section is where the anesthesiologist's information will go, making sure that the correct provider type is indicated. And in the following box will be where the type of sedation will be indicated, making sure that if the member is being seen in an ambulatory surgical center or an outpatient facility, that last option of anesthesia will be covered under medical carrier be selected. And then the next page of this form will be specific to in-office sedation, selecting yes or no as appropriate for the attestations. The next section is where you'll indicate the qualifying factors for the need to be treated under general anesthesia. You'll select all that apply. And then any other factors that will help determine medical necessity should be listed in the additional factors box. And of course, the last thing on the form is making sure that the treating provider signs and dates the form before attaching it to the authorization. So next, for the dental anesthesiologists, they will now be contracted with MCNA. So with this, sedation services performed by the CRNA employed by the dental anesthesiologist, those services may be billed as a delegated service under the dental anesthesiologist license and MPI. The contracted dental anesthesiologist, though, will be responsible for ensuring that the CRNAs have a current non-restricted license with the Idaho Board of Nursing and that all services performed are in compliance with the Idaho State Board of Dentistry rules and regulations. So upon completion of treatment, the dental anesthesiologist will submit the units of in-office sedation that were provided, represented by either the 9222 and then the subsequent 9223s utilized during treatment for consideration. Payment for all units will be issued under the procedure code D9999 in the global amount approved by the Idaho Department of Health and Welfare. Dental anesthesiologists are not required to bill the D9999 separately, as it will automatically be applied by MCNA, but you're welcome to do so if you choose. Next is just a few helpful reminders. So pre-authorization submission for the D9999 will indicate to MCNA that the member is receiving dental services under general anesthesia performed in office, but the treating provider would not bill for this code, only the dental procedures that are performed on the data service. Next is prior authorization submission for the D9420 would indicate to MCNA that the member is receiving dental services in an ambulatory surgical center or an outpatient hospital. Next is please make sure that the additional factors section of the Idaho Smiles Dental Anesthesia Prior Authorization form is completed to the best of your ability, containing any clarifying comments regarding the need for sedation. And then lastly, post-treatment review is an option for urgent treatment. If services are performed on an urgent basis, please make sure that the Idaho Smiles Dental Anesthesia Prior Authorization form is completed as you normally would, and just submit it with your claim for consideration. And lastly is the contact information for your provider relations team. For any assistance, both of your reps can be reached at idahopr@mcna.net. Thank you again for taking the time to review the updates for general anesthesia. If you have any questions or would like to go through this one-on-one, please do not hesitate to reach out to us.